Anemia. There are several types of anemia, each with its own cause, and depending on the severity of the condition, it can be a temporary or permanent medical condition. Anemia. Important information. Anemia is defined as a drop in one or more of the red blood cell measures, which include the following. The amount of basic oxygen-carrying hemoglobin in the blood is known as hemoglobin concentration. Hematocrit, the deposit of blood, or the percentage of the volume of red blood cells in total blood volume. The number of red blood cells in a given volume of blood is known as the red blood cell count. Different types of blood cells. Blood cells are divided into three types: red blood cells, white blood cells, and platelets. Leukocytes, these white blood cells help the body fight infection. Thrombocytes, these cells aid in the clotting of blood after a bleed. Erythrocytes, red blood cells, these cells transport oxygen from the lungs to the body's vital organs and other tissues. Hemoglobin information that is important to know. The following is important information about hemoglobin in the blood. Hemoglobin, a red iron-rich protein, is found in red blood cells. Hemoglobin helps transport oxygen from the lungs to the rest of the body's organs and transfer carbon dioxide from the body to the lungs, so that it can be expelled from the body in the process of exhalation. The bone marrow, a red spongy substance found inside the large bony cavities in the body, is constantly producing most blood cells, including red blood cells. The body requires iron and other minerals, vitamins, and proteins found in food, as well as a few hormones, the most important of which is erythropoietin, EPO, which the kidneys secrete to produce red blood cells. It is worth noting that a red blood cell's average lifespan is between 110 and 120 days. When a person has anemia, his body does not produce enough red blood cells, and many of those that do are lost or destroyed faster than new blood cells can be produced. Males and females have different anemia test results. Anemia is defined by the results of blood tests, which differ between men and women in the following ways. Males, hemoglobin concentrations of less than 13.5 grams/dl and hematocrit values of less than 41%. Females, hemoglobin concentrations of less than 12 grams/dl and hematocrit concentrations of less than 36%. Hemoglobin levels differ from one another. Some people have normal hemoglobin values that differ from the rest of the population for genetic or hereditary reasons, as well as lifestyle factors. The following are some of the categories. Cigarette smokers. Because anemia does not show up in laboratory tests, smokers are known to have higher hematocrit values than non-smokers, making detection difficult. Highlanders, Scottish. Higher altitude residents have higher hemoglobin levels than those who live near sea level. People of African descent. Hemoglobin levels in African Americans are 0.5 to 1.0 grams/dl lower than those in the rest of the world. Sportspersons. Athletic people have normal hemoglobin levels that differ from what is considered normal. Anemia signs and symptoms. The severity of the patient's condition, the extent of the disease's progression, and the patient's need for oxygen all influence the appearance of anemia symptoms. Anemia symptoms usually appear if the disease progresses quickly, but if the disease progresses slowly, no symptoms may appear because the body has adjusted to the new position. The following are some of the symptoms of anemia, which vary depending on the cause. Tired. Pale complexion. An irregular and rapid heartbeat. Shortness of breath. Chest pain. Dizziness. Changes in the cognitive state. Cold hands and feet. You have a headache. A myocardial infarction is a type of heart attack. Anemia's causes and risk factors. The causes of anemia and risk factors can be explained by the following. 1. Causes of anemia. The types of anemia can be divided according to their causes, as follows. Iron deficiency anemia. Iron deficiency anemia is one of the most common types of anemia, affecting approximately 2% to 3% of the adult U.S. population. The reason for this type of anemia is that the bone marrow needs iron in order to produce hemoglobin, and in the absence of good amounts of it, this may cause a decrease in the production of red blood cells. Vitamin deficiency anemia. The body needs many vitamins, such as folic acid and vitamin B12 to produce an adequate amount of red blood cells. An incomplete diet may reduce red blood cell production, and there are some people who suffer from the inability of their body to absorb vitamin B12 effectively. Chronic illness. Anemia is caused by many chronic diseases, such as cancer, acquired immunodeficiency syndrome, AADS, gout, Crohn's disease, some chronic inflammatory diseases, and kidney failure. Aplastic anemia. Aplastic anemia is a rare, but life-threatening type of anemia that usually results from a reduced ability of the bone marrow to produce all types of blood cells. The cause of aplastic anemia is still unknown in most cases, but it is believed that it is related to diseases that affect the functioning of the immune system,